Very good evening to everyone. Welcome everyone for this webinar from KCSI, an important topic mainly on thesis for the postgraduates and how we are going to do it as a publication, especially for the consultants and the people who are working in the medical college. So before we start, and this session is moderated by Dr. Kalaivani. Kalaivani ma'am is a member of Executive Committee of KCSI, and she is also the scientific committee chairman, and she works as a professor and unit chief in Saptagiri Medical College, Bangalore. So before we start, I request our chairman, Dr. Narayan Chandra Hepsur, to do the welcome address. Narayan, sir.
Thank you, Chandru. Good evening, everyone. I welcome our chief guest and the main speakers today, Dr. Nandakumar and Dr. Chidambara Murthy. Thanks to our scientific chairman, Dr. Kalaivani madam, for bringing them to this august audience, presenting them. And I welcome all the office bearers, all the surgeons, all the postgraduates, all the undergraduates and the interns for this program. I request Kalaivani madam to please go ahead and start the program. Let's not waste time on other things.
Okay. I thank the chairman and secretary of Karnataka State Chapter for this opportunity. At the outset, I would like to invite both the speakers. Both are eminent speakers and they have achieved a lot in their own respective fields. And they have been my colleagues and friends for quite some time. And I feel proud that I'm associated with them. So we have two speakers. One is Dr. B.S. Nandakumar and we have Dr. Chidambara Murthy. Dr. Chidambara Murthy is currently the professor and dean of Newburgh Anand Academy of Laboratory Medicine in Bangalore. Before this, he used to be the chief scientist in research scientist in Ramaya Medical College. That is how we are associated with each other. He is having several achievements in the form of many contributing to many international books, national and international chapters he has contributed, and he's been obtained several awards and many publications, national and international publications. If I talk about it, half an hour will go only in that. So he has also been serving as visiting faculty to many research board and to institutes and universities. And he also has some interest in Kannada literature and translation of information. I have just not introduced him at all. This is very, very, very brief. Dr. Murthy will have one session only for your introduction. May we have Dr. Murthy to please talk on mainly concentrating on why research for medical experts. We always think that we should only operate, but we should know why research is important for us and what's the purpose of the research in UG and PG curriculum, which is a big question everybody asks. What is the source of research problem? What are the components of research proposal? And how to write a synopsis and how to write a project proposal. And finally, he'll touch upon the scientific writing and a little bit on reviewing of the literature. Dr. Murthy, please take over.
Thank you, Dr. Kalaivani. Am I audible?
Yes.
Sir.
Yes. The slides, sir. Full screen is seen, no, sir?
Yeah, you have to make it full screen.
Yeah. So thank you. I start my brief presentation by thanking KSCASI and all the office bearers and Dr. Kalaivani for inviting me and Dr. Nandakumar for this presentation. Basically, I want to share few thoughts on being a non-medical. I have done a PhD, MPharm and PhD, and closely worked with the medical fraternity for last 15 years. So out of my 20 year of research career, I spent 15 years with doctors. And I want to share today, like, what is the advantage of medical faculty, especially surgeons doing research, and with their busy schedule, how they can plan and what are some of the resources. And my close friend and Nandakumar and me, we work together for almost 10 years. So wherever I start, he can take you further on how to develop a protocol and other things. And since next 45 minutes to 50 minutes, we are trying to achieve too many things. So I want to focus mainly on planning of your synapses, since the audience are mainly academicians and practitioners and the student. We thought we throw some light on how to frame a good research question and what it takes to do so. So, as we are discussing research for surgeon, so surgeons, surgery itself is a highly skilled and professional accomplishment. And if you ask me why, we are already accomplished with lot of skills and skill sets. So, do we really need to do a research? So, what I want to answer is, if you don't do a research, so what will be the outcome? So, then probably that question will be thing. So, in part one, as Dr. Kalaivani told, we'll just briefly touch upon why research for medical expert, more so for surgeons, and what is the purpose of research for a student and a faculty. Like we have academic mandate from universities and guidelines saying that it's a partial fulfillment of your degree, but is it only to fulfill the minimum requirement, or it has any other? So that will help you to understand the research in a better manner. And where is the source of research problem? And this was mentioned as identification of the research topic. So let us also see where to search for a research, good research topic, which is relevant to our community and our practice. And also briefly, I want to touch on what are the different components. And synopsis is always a smaller version or miniature of the research proposal, where the university has laid down the guidelines so that a student will have an idea about how to make a research proposal in future. And how different the scientific writing, and we are all good in literature, and we are all good in writing lot of things which is for the exam purpose and also for the communication. The can the communication what we do day to day, will it be same for scientific writing, or how different it is, and what we need to think. And review of literature is something what they wanted us to touch upon, how to do a good review of literature. And this will be continued by my friend Nandakumar, where he will take you through rest of the things. And this is the disclaimer, since I represent a private company, which is previously known as Anand Diagnostic, Newburgh Anand Diagnostic. So, why research for a medical fraternity? So, as I told, your primary role is to provide healthcare. And we are all busy doing, but you have a lot of patient and you are a handful of work, and are all busy in, as Nandakumar was mentioning, you are busy in fixing the issues, surgery. And where are the major research requirement required? Because unlike a medicine, if I want to invent a new drug, a chemist will work, and then a pharmacologist like me can work on developing a model and coming up with a new drug. Whereas the requirement of surgery is a tool, a technology, and a new method and new means to conduct a surgery for effective outcome. And you all, as I told, you already have a high precision, accuracy, speed, safety, and you are working in within these ambit of thing. And if somebody else want to do a research and identify something required for you, he or she may not have all these things. They may not have the precision. They may not have the, so they won't understand. They can't really fit into a surgeon's mind to hypothesize and find out exactly what is your requirement. And otherwise, it results in fitting into the existing resource. So instead of that, what I feel is for surgeon, it is a keystone for advancement factor. Like if you want to conduct a surgery efficiently, you need to identify what tool you need and what is the technology that best suits for your requirement. We can give theoretically, whatever research gives theoretically, end of the day, you are the person who are using it. All these tools, technology, means and method should come from a practicing surgeon to understand. So involvement of a surgeon can be really a good impact on research. Otherwise, it ends up in a non-surgeon or somebody who is not involved in the surgery doing research is like a theoretical swimming. We may tell 100 things, we may put all the physics phenomena, formula, everything, but when you really get into water, it's altogether different ballgame. So the surgeon or the medical practitioner involving in a research will definitely provide a better outcome because they are the end user in most of the surgical intervention. And yeah, So what is the difference between, like, will all the research lead to innovation? This is something which I frequently get a question from medical faculty. Like, we always say, see, research is a systemic means to identify, understand the need, and undertake the process and work on the analysis, which is finally leading to a meaningful outcome. So basically, all the research may not need to innovation, but research is a means to innovation. So the innovation may be as simple as this, and many of you may think that it is a simple jump clip. What is the innovation? And uh, the amount of royalty that person who invented this jump clip got is it runs in multi-million dollar. It is a pattern in which a metal piece is being bent to suit the. So the research may be from simple jump clip to the latest surgical tool. So as I told, research, see, both are research here, and they have their own application and advantage. Being a surgeon, you need something what is required to meet your requirement in a operation theater or patient care. So I personally feel that you are the right person to identify the problem, and also once the product or protocol is developed, you are the person who are capable of providing a best review or you application. So unless you personally get involved in research, I think you have to uh, use the available one without much comfort. So what are the qualities of a research? Like, all of us, we do a research for a period of 1 year, 6 months, or a shorter period, may not be able to reach a outcome of innovation. But it, as I told, it's a means to reach innovation, and several such research protocols can lead to a quality innovation. Some of the basic fundamentals what we practice in research methodology or research question is have a clear question to address. So basically, to develop any small tool or any, you need to have a very clear and simple question. After this, you need to have a well-planned activity. The activity should lead means to the question. Like, the question can be broken down, and what we call it as a research hypothesis, a research question, and that is fragmented into 2-3 workable format that is called objectives. So well-designed and planned activity will always become your objective, and it should be logical and evidence based. So most of the medicine, we work on evidence based, and for surgeons it is more of a logical and your requirement based. As I told, I always mean in research for surgeon is more of a tools and supportive equipment. So in that, it should be more logical and it should be universally acceptable. We cannot make a tool for one person and call it as a global research. It should have some broader application, and it should have a direct application or means to application. What it means is, lot of dissertation and small synapses what we do, most of, as a student, we think that okay, I'm just doing it for 3 months or 6 months, will that help the medical fraternity? So the question you ask should be providing a means, or it should take you to 2-3 such synapses, or project should lead to a tangible outcome. That's where we work on most of the medical research problems, and it should provide or create a better or a new knowledge or understanding on already known thing. So most of the time they call it as a repetitive, but for me, knowing the genetics and variations in medical science, repetitive research with different population is still a valid compared to life science and other areas, and it should lead individual to reach a better outcome, and it should also address an important issue. One of the common issue faced by most of the people, we should select, and that will have more impact. And sometimes the benefit should overtake the cost and resource. So this is something we always say that industry can do this. No, we have seen lot of ideas coming from engineering student. When they work with surgeons, they can come up with very economic and cost effective alternates. And when the same thing is given to a company, they add all the cost, they go for patent. What cost 100 rupees may become 10,000 rupees because of other indirect costs. So any small research that can directly benefit will also take care of the economy of the resource. And finally, all the work what we do should be directly or indirectly benefit to the society, humanity. That should be a long-term objective. All the small projects should lead to a tangible outcome directly or indirectly. And we, as a student, I mean, this is my perception when I was doing the research, and now most of the students say, sir, I am a postgraduate, I am going to do a super specialty. So I just finished this research as a formality. Rajiv Gandhi University says that you have to do research and publish a paper. I just want to do it for sake of fulfilling the requirement. But for me, after working for 15, 20 years in research, I now understand university has designed the research opportunity for all the not only in medical, in most of the postgraduate, for them to teach something behind the research. So these are some of the issues. It is means to teach a student a particular subject in depth. So when they do research, they don't go by the syllabus or the framework of what is prescribed. They go deep into the matter and they try to understand it more than what they are supposed to. And it is a way to ignite the mind to think in a more productive way, and setting a practical goal. So if I write a synopsis, and I know university has given me 9 months of time to do a research, and if I can't plan it all the 9 months, I should know I can plan my work only 4 to 5 months. It some time will take for collecting the literature. I have a lot of challenges during my work. So practically, it is helping me to set the goal not only for research and rest of my life, and it make you to understand the process. We always tuned or taught with ready to use material. In the classroom teaching, we are mostly used to ready to use, but here you have to create your resource. You should hunt for resource, and also you should search for the, because within one resource or one setting, it's very difficult to do a research. You always need a interdisciplinary approach, for which you may have some facilities. You have to go out of the way to make these resources available. And we should also collect different resources. It's not only a research. A sample is given and the sample is sent to some genomic analysis. You do surgery and collect the sample that is sent to somewhere. That lab will report, and you have to coordinate with the lab people. From if the test is not done in that lab, again they outsource. So this is a means of you to manage the entire process, because once you take a research as a student or as a principal investigator, you own this project. Basically, you will be running the entire show. So this will also help you to know how to integrate the knowledge, because when you send it to lab, you have to listen from pathologist, biochemist, or microbiologist what is the process. You need to understand and integrate that to your work. And once you do a research, it will teach you how to integrate the knowledge and also organize the information. Once you go and meet specialists like Dr. Nandakumar, you ask what is the sample size. So we all feel that, okay, statistics, they give a sample size, some magic number, we do it and finish. But once you do it, what is the logic you use? Will that sample size enough to prove your hypothesis, or why can't we go for more? What happens? So all these things will help you to integrate the information which is required for effective outcome. And once you finish, as I told, when you are presenting a research work, the people will have questions from all the angle, starting from ethical committee clearance till the sample size. And most of the doctors I have seen, they explain everything well. When it comes to a sample size justification and all, it's a little difficult for them. So unless you understand this with proper reason, it will be difficult. And also, what is the best way to present it? It is not only using tools like PowerPoint and other things. When you are convincing your research, basically you are telling what made you to choose the topic. And why do you think that is the issue occur? And you need to give a justification. You can't say that somebody gave me a topic and I did. No, you own it. It will teach you how to present a concept to somebody who is evaluating your capabilities. And is also the best way is to follow the instruction, starting from writing the synopsis. When you write a synopsis, you go to university website, you download the format for the synopsis, and when you are writing, starting from the title, you need to follow the instruction given in the university or the college. And from then, once you write the thesis, finish your work and start analyzing, you need to again follow the standard practice. For writing your dissertation or thesis, you need to follow the pattern. And once it is done, publication is another big challenge, where reading the instruction, following it will take much more time. And this will help you after research also how to read a protocol. And so all these things, if you see, it will not only help you in the master's program, but all these things are linked to a life skills, which will definitely help you to make a good professionals. And with the same thing, as I told you, for the faculty, what they expect you to contribute your intellectual things. Like it is to identify a new and right issue for the society. What is the right? Like they have experts panel or people who are working for many years to identify the right issue for that particular healthcare system. And it is to assessing the issue with knowledge, because people from the industry always assess the issue with the commerce, but they want somebody to assess the issue with knowledge, who can give very good thing without affecting ethical and legal issues. So academician and research are the ones who can do that. And also to address the larger issue in the area, because of your expertise, you are capable of having a larger vision on any particular problem and provide amicable solution. And also integrate the knowledge and expertise for your novel outcome, because we all know that in medical science, in the field, in the side of medicine, it is research is a constant thing, whereas in surgery, the outcome may not be as quick as the medical part. The reason is it takes a lot of time and effort to integrate the people to work towards it, and also to develop a most valuable outcome for local need. This is something all the Indian funding agency, even WHO, NIH, all of them, their primary focus is to address the local issue. So if you see this, the faculty need to work on issues which are locally prominent, and optimizing the outcome and resource. The same research, if a company takes over, there, as I told, their approach is mostly on the commerce driven, and they may cost the outcome very high. So that's the reason why a lot of academicians are approached by funding agency to make it practically viable. And yeah, it is also any college or institution or individual is ranked on the research metrics. This is to demonstrate our knowledge of our surgeons or medical fraternity in a global level, and integrate the resources for useful outcome. Like even we have seen in COVID, there was a race of medical research in all the angle. So that is also help as a country. It will demonstrate that why India is still number one in medical tourism and medical treatment. So these are some of the things. Apart from what I gain for myself as a researcher, you'll be indirectly contributing to the society. And this is the question what Dr. Kalaivani wanted. So what is the source of research problem, or where I get the research topic? This is something we always wonder, like history of medical science. So do you want to understand the history and identify the gap and work? This is part of the resource. Literature available, probably the medical and non-medical literature what we available can provide you some, and your library where you get information from all the angle, that will be one of the source. Online and internet, which provide you with chat GPT, you can get many problems thrown by the system, but it is a synthesized one. And also the good problem can be identified with discussion with especially your own colleagues and interdisciplinary people. These are some of the good sources of your problem. Discuss any issue, any case with multidisciplinary people. You get to get a very good question, research question asked by them, and that can be your source of problem. And observation is something what we need in day-to-day activity. In your surgical skill will give you a lot of question, and it can lead to identify the research problem. And practical experience, like as you see, initially you start seeing 100 to 200 patients, probably you can pick up what is the issue, or what is the gap between the current practice and the requirement. And day-to-day activity, and I personally feel your awareness throughout the day as a medical student, as a practitioner, your awareness throughout the day will be the best source of problem. You need not get a problem defined by somebody. If you feel that is a problem, please discuss with your own colleagues. Identify it is, once you get an idea that it is a universal issue, that will be the best research problem to work with. Apart from all the sources, your local observation and looking for what is required locally, as we say, local problem with global approach will be one of the best source for your research work. And we all know that these are the fundamentals of thesis or dissertation. We have to have a title, research question to be asked, and we need to define a hypothesis. And to meet this hypothesis or prove this hypothesis, we need to set few 2 to 3 good objectives. And these objectives should be followed by a standard and internationally recognized methodology, and use basic statistics to analyze what before that you need to know what is the sample size required, use the thing, and then use statistics tool to analyze the outcome, and also give briefly your application or future work, like whether you can have an endpoint with this, or you need to do such higher or larger study to make it more applicable. And then, of course, ethical issues from the beginning you need to know. And if this is the standard protocol, most of the dissertation and thesis. But if you are writing a proposal, it is in the same, as I told, it's a major full version of the research project, where you have cover letter, summary, introduction, problem statement, goals and objectives. You can see the smaller version has been elaborated with the angle of higher a larger outcome. So goals and objective and approach is nothing but a methodology and how you evaluation plan, and then what is your organization capacity. If you are working on a research, even if you are working with a hospital or a academic institution or a medical college, so what support you have, what facility you have, and once you use that, you need a fund, like for what part of the project you need fund, all those things you need to think. And then funding. And so as this is a lengthy process, and we need almost 3 to 4 sessions to cover each of this. But in today's session, we want to give a bird's eye view so that we can have interaction. Whoever is interested can we can take a workshop mode, so that way we can go detail one by one how to do. I briefly now take an example, since it was asked to address the key component of the synapses. I've taken example from Rajiv Gandhi University pattern, where they have, these are the topics from the synapses. If you go and download the synapses, these are the things. Topic of the title, need for the study. So we need to know how to give a topic of the title. So basically, when they are asking you to do a research, they know that you already have expertise, and you are trying to do something which is applicable immediately, or which will have an advanced outcome. So the title should not be started with words like to study the process or to understand. So these are some of the guidelines they give. So I'll just brief them in a next slide. And then they also ask you need for the study. This is to say that whether you are working on something which is meaningful for the current scenario. So, and then Review of literature, I'll just touch upon that. It will have three major parts. One is you are introducing a topic to a person who is evaluating or understanding, and what is the progress that has been made in that topic, and then the recent update, and also what are the gaps. So end of review of literature, you are bringing out the gap in the knowledge with respect to that topic, and then you will be addressing one of the gap. That's how you introduce the review of literature to title. I mean, you link both of them, and you have objective of the study. As I told, objective of the study, we can't have multiple major objectives. It should be one or two simple objective. It is time bound and outcome based. So that needs to be kept in mind. And materials method should directly link to the objective. Whatever objective you have given, that materials and method you use should directly address that. And again, we have source of data. Since we are working with human subject, these are some of the other things. What are the inclusion criteria? I think Nandakumar can explain it better. So he has a lot of examples where inclusion and exclusion criteria are messed up and confused by many of us. So, and what is the sampling method? What sample method we are using? And under the method of collection of data, you have materials and method. Like what is this? How you are recording the information, medical information that you need to do. And these are some direct question. Does it have a human ethical, human subject? If yes, we have to follow ethical committee. These are some of the standard guidelines provided by the university. And briefly, I will go one by one so that will help you when you are writing the title. We have seen the research article from almost 50-60 years. The recent trend is title should be objective, and they also use the outcome in many of the title, and technology applied. So mostly you end up seeing using advanced technology or using NGS technology, genomics. These are the things they want to showcase: the primary objective, outcome, and the technology applied. Okay, so these are the things that needs to be highlighted when we are writing a title. And when you're asking a research question, it should be a direct and again practical. That means within the time frame you need to you can finish that, time and resource bound. So within the ambit of your resource in the college, if you're doing in a hospital setup or a clinical setup, these things should be kept in mind to frame a research question. And hypothesis, it should be clear and open-ended. In research, we always say that there should be scope for negative outcome also. That's why it's called open-ended. Otherwise, it is objective-driven research where we know the result is only positive will work. But most of the medical research are open-ended, where you get a positive result, you proceed further. If you get a negative result, you report it, so that there is no unwanted or undue effort by others to do such work. So that is the benefit for negative research. And then when it comes to objective, better for any synapses or any small project, we need to have 2 or 3 clear objectives, not more than that. I have seen people writing 7-8 objective. Objective is not an experiment. Objective is a group of experiment which prove a part of hypothesis. So let us be very clear. It is always better to have 2 to 3 simple objectives which are further divided and linked to methodology. Using 1 or 2 methodology, you need to address each of these objectives. And again, coming to a basic statistics, the sample size. What is the justification for sample size? I know we use the previous literature or our own experience and try to calculate the sample size. And once you collect the information, the pattern of information, how do you record it? How do you store it? And what is the analytical tool or statistical tool you are going to use need to be spelled out. Like we know generally, if I go and talk to a statistician and experts like Dr. Nandakumar, they give some words which we never understand. And please make sure that if you want to be in a good research and practice, please understand what is t-test, paid t-test, mean, median, mode. These are some of the basic things which will make you good presenter, and also it will help you to explain your outcome better. Otherwise, you say it is significant and p value, so what that mean? So if you can understand some of the basic terminologies in statistics, I think that will help you in a long way to explain your outcome. And then application of work, as I told, all the research we undertake in 6 to 8 months need not solve the problem. They can be a means to a bigger problem, and it can help in solving, understanding some of the issues, not only solving, understand some of the issue. And ethical issue, I know institution human ethical approval is required. For that, if by the time you fill and face one or two ethical committee meeting, I think you get other perspective also. What is the perspective of an expert? What is the perspective of a legal person? The constitution of IHEC is such that you get to know the perspective from all. Take all the questions seriously, because ultimately when we present our outcome, it should be acceptable by the society. So it should make sense to everybody in the ethics committee. So please make sure that ethics committee comments are considered, and keeping the safety for an individual at the forefront. And references, again, all articles and information. So nowadays they also want you to quote websites where we get a lot of information. Although it may not be systematic, we get an information from website. When you are quoting a website, it is important to state the date on which you access the information, because most of the websites are dynamic, and we need to quote the date of accessing. And we all know how to write a reference for a research article and for review paper, book published. So we have a lot of online resources. Dr. Nandakumar will mention few of them. As I told, each of these subtopic would be one session. If we conduct many programs, so they can go as a one session. So today's session, we are giving all the brief information, so that it will help you when you are planning your thing. And any of this topic, if this group finds interesting and they need more detail, we are there to help you out. And again, coming to the topic which I mentioned, scientific writing, we all feel that, okay, I'm conventionally educated, I know English from last 15, 20 years, I know good English, so I can write well. But what we write regularly is not the same language what we use for scientific writing. So how it is different is, it is for a specific audience. The article you write or a scientific journal information you write, it is not for a public. There we have a serious audience who are reading your article for particular information. So that's where it's different. Keep the language simple and clear. So we also have international audience like us. There are many non-English speaking audience who are reading your paper. So we need to keep the language very simple and clear. And we need to use standard abbreviation and protocol. Whenever we are mentioning a protocol, you give a reference or internationally accepted protocol from all of your scientific bodies. You have to mention them. Provide only necessary details. So there is no scope to fill the gap in scientific writing. It is only with a specific structure you are writing. And be clear what you are trying to say. So many of the journals, when I send an article, they say like the language is too complicated. Make it simple and straightforward. These are the common comment we get from. And wherever possible, keep in mind that reader outside your expertise. For example, a surgeon written article will also be referred by engineering student to see how they can help you. So interdisciplinary people should also make sense of your research article. So that is another thing we need to keep in mind. And wherever required, we need to use flowchart, scheme, and diagram instead of writing essays. And this is something which I observe. Use always future tense in synopsis. Synopsis is your commitment to do a work further. So we always need to use future tense, and past tense in the thesis. Thesis, so you have already completed the work and you are writing a thesis. Most of your methodology and results should be in the past tense. So I've seen vice versa in many cases. Please make it a habit and strictly stick on to instruction. So my research mentor always used to say, more than you read, write an article, you read the instruction 2-3 times, understand. So we read between the lines. So this is something very important. Start practicing from the initial stage and provide sufficient background need for the study and gap analysis. And gap analysis, what is required? You need to introduce, as most of the research papers, introduction will start with telling the magnitude of the issue or giving the statistics of global prevalence. So this is to make you understand how important this issue is. We need to give sufficient background. If the people are not from that area, they will also make sense. And discussion should be done only in view of your results comparing to the literature available. So the discussion, we don't have right to discuss others' work. We can use their outcome to say that how we connect or how we interpret our research. So discussion is not a part to say how good others have done, how best I have done in my research compared to the existing information. And do not extrapolate your outcome. So this is something which always all the teachers say, that if I have done a study using 20 subject, finally my outcome should be limited to that. Out of 20, we could see 18 or 16. The positive outcome remains. So I can't say the same 20 can be extrapolated to 200 or 2000. So this is something we need to keep in mind. So yeah, these are some of the tips. I will share these slides because this I got it from one of our classes where I attended. So it gives an idea how to organize your scientific writing. They have around 18 tips, like organize your thoughts and idea. This basically, if you follow this instruction, whatever I told last 5 to 10 minutes will be covered. Okay, how to make a meaningful paragraph and how to use grammar for convenience. All those things, this will help. And this is something which Dr. Kalaivani asked me to talk briefly. So review of literature, the objective of review of literature is to identify what is already known. It is review of literature will redefine what is known, and it will get an idea about what needs to be done. Like by reading the review of literature, as I told, we need to know what is already done, how the journey of this particular topic started. It should also help you to avoid the duplication. Your research should be different from the review of literature. Otherwise, it will be repetitive research. It will help to stream the problem statement. Basically, you are giving a direction. It is like a background information. To ask the right question, as told, asking a right research question is very important. If you have a right review of literature, with all the existing information, you can always pick what is the gap and how you are going to fill that. So it provides the background to a reader about the issue or a topic you are working with. So good review of literature should be comprehensive and it should have up-to-date information. I should not stop the information pre-COVID era 2019. So after that, I don't want, because a lot of people have worked on that. Let me hide. No, you have to give up-to-date information so that they feel that your work, you have knowledge of what's going on in your field, and it should be systematic. And the review of literature should be reproducible and free from bias. We can't say that the study what they have done in 40, 50 years back has no meaning. So thinking the resources and science at that time, we need to take the information positive from that, and right, and it should be from the authentic source. Please make sure that all the review of literature should be from internationally recognized or PubMed index journal. So that will have more weightage then, and it should be clearly searched and selected. As I told, it will have three major parts. First one is a basic. You are defining first paragraph or first part of the review of literature. You are defining the problem. You start from the discovery and first report on that particular topic and initial purpose and identification. Then the middle part or the second paragraph should talk about development, what modification they did with the original identification or original fact they found, and breakthroughs that have happened in the area. And then last part should be a recent work done and what are the recent development from other part of the world and our own country, and that will help you to come up with the existing gap. So all these things, so this is the process. Collect lot of literature, authentic literature, arrange them chronologically, identify the development. What is the progress from the discovery to now? Write a key point from each of the article, combine the information along with the reference wherever required, then identify the gap and link to your current work. So this is the more scientific approach of writing a review of literature. With this, I'm going to summarize briefly, pass it on to my friend. So it is important for medical practitioners to involve in research, more so for surgeons. The purpose of research could be to understand, provide input for a larger problem solving and or solve the problem. Surgeons involved in research will help to address the issue more effectively than others working for you. For student, research is a mean to teach multiple skills. As I told, don't think it's only a mandate from the university. It will also have some lot of hidden teaching for your lifelong learning. Research for expert is to contribute to discovery and society. And synopsis is a mini proposal to express your research idea. So review of literature will provide a background information and opportunity in the field. And yeah, as I told, research is the only process where we are trying to convert the challenges into opportunity. So take it positively and try to address even the small issue in a positive approach. With this, I think I want to again thank, and I will pass it on to my friend Nandakumar. So I'll be there to take any question at the end.
Thank you, Dr. Murthy. That was really probably it is really thought provoking the way you put things across. So everybody, surgeons always wonder why should we even take up research. I was one of them. No, so I said, I used to be, why are they pushing this onto me? I'm not interested, is what I used to think, and now I'm part of the scientific committee. So that's how it goes on. So we now have, thank you, Dr. Murthy. We will now request Dr. Nandakumar to please take over, who is the professor of surgery of community medicine in MS Ramaya Medical College, and he's also the associate dean and what research and position associate dean research and innovations of Ramaya University of Allied Sciences. I request you to please quote some examples so that it will be a little easier for for all of us to understand. Dr. Nandakumar, please take over.
Absolutely, ma'am. Thanks for that introduction, and thanks to the Karnataka State Chapter of Association of Surgeons of India, EBSUR sir, and seniors on the panel. In fact, when Dr. Kalaivani asked us to speak about the synopsis, speaking to surgeons, it's difficult because you're precise, sharp, and it has to be done. So what I will do is, it took some time for me to put together a few slides. And rather than the theoretical part, which Murthy mentioned, we will not talk about theoretical swimming, but we will actually swim with examples. So the million-dollar question when you're in the OT is to cut or not. And where does that evidence come from? That is what we are going to see. Are surgeons good researchers? Absolutely yes. Because today, whatever modern surgery that we are looking at is because of the toil and the efforts put in by surgeons of the past. Gone are the days when we used to rely on anecdotal evidence. Okay, this works for him and it will work for us. But today we are seeing variations. We want evidence, we want proof. And where does that proof come from? So the whole challenge of research has been to generate that evidence with minimal bias, which works in all situations in the same manner and gives the same effects for whatever condition it is. But the challenge a surgeon will face is how to arrive at these standards. Because when you're looking at the various complications, it can be related only to the surgeons. Because when you look at lack of funding, when you look at time pressure, the OT availability and the number of patients who need to be operated on. So there are certain challenges and you don't have the luxury of doing that. Methodology related challenges, because when you say that undertake research, it's not easy when we see in, let's say, a pharmaceutical trial, or when you take an observational study. Here, it is the intervention, randomization is a challenge, and there are several things that will actually make it far more difficult in the methodology and when we write the protocol. I'm going to give you some examples for that. And third is the ethics challenge, because it is an intervention, it has to be done. And earlier concept of placebo in surgery, some of the senior surgeons might remember creating a sham. What it meant was a kind of a similar to the procedure, but not the procedure. So today in the realm of ethics, it might not be acceptable to do that. So in that context, when we look at the barriers to development of evidence in surgery, it can be the methodological barriers. It could be the demand that it requires to have that learning curve, and also with regards to the protocol per se. So when you look at the global trends today, the number of articles or the number of funding that are being received by surgeons for research has drastically come down. And this has been reflected both in the New England Journal of Medicine or the NIH grants. There are only 14% of the grants which are being provided to surgical interventions, as against 72% for pharmaceutical or AI and ML based methodologies for various other researchers. So when you look at the methodological barriers, what happens in surgical interventions are extremely complex, which means that it is not just one intervention, but you have multiple professionals, multiple conditions, and multiple post-operative complications, which are dependent not just on the procedure, but for a plethora of other post-acute care. So in this context, when you are actually trying to develop something, the ideal situation, what you mean by this is, there have been a stepwise approach for evolving surgical evidence. Innovate, develop, explore, assess, and have a long-term study. So these are the processes in which the surgical intervention becomes practice. So towards that, there are several challenges even with this, because ultimately the gold standard, what we considered for research, is randomized controlled trials. So what happens when you go for randomization? In surgical procedures, it's very difficult to say that I'm going to allocate the patient who is having a particular indication to a group, and the same type of patient to a newer procedure wherein we don't know what the outcome is. So a lot of beneficence and non-maleficence comes in there, which brings us to the question. Now I'll take a minute, and I'm seeing quite a lot of participants. So if one of them can just unmute and say what is happening here. And this is from a very known this thing, a very experienced surgeon performing a lap cholecystectomy procedures has a 14% higher complication rate than his colleague, who is a 2-year-old young assistant professor performing the surgery. So what do we infer from this data? Can someone just throw some light on it?
It shows how much he has gone through in detail, or how much he has been trained by his teachers.
Certainly, sir. Certainly. So Hebsur sir, being the very good teacher, he's saying that the younger generation has a better this thing. But can someone...
Experienced surgeon is doing only bad cases compared to a new surgeon.
That's the truth. That's the truth.
And doing more surgeries.
Doing more surgeries, absolutely. That's why I put the percentage, madam, not the absolute number. So in research, that makes it very important. And we are taking it as a percentage, 100 each. It's not just the absolute numbers. See, this is a very fine example of confounding bias, which we see in thing. And as somebody just mentioned, an experienced surgeon, the case which comes to him will be a more complex case, will require more what you call as procedural challenges, and also the prognosis of the case will depend on the complexity which is coming to him. As a consequence, the complication is not attributable only to the surgeon's efficiency, but also the underlying factors which have come in the first place. Unless we factor in And if we just draw an erroneous inferences, which is what happens in most of the research, we say that, look, we got a result, the p-value is not significant, we will junk the paper. Because it is very, very challenging, more so in surgical sciences, both to design a study, to undertake a study, and perform under ideal testing conditions. Because what is ideal for a, let's say, an RCT where we say 4 milligram, 200 micrograms, it's going to that precision. But when it comes to a surgical intervention, the surgeon's ability for the same type of procedure under different settings, if there is a hypotension, if there is a traumatic injury and the site is having very heavy bleeding, then it changes everything. So in that context, creating that ideal testing situation for doing research itself is a challenge. The third thing is the availability of such cases in large numbers. Because as Dr. Murthy was saying, sample size. Believe me, today when you're going for a very complex type of cases, the number of such cases will be very limited. And if you want to innovate a particular procedure, no amount of simulation will prepare you for the actual type of cases that you tend to get. So in that context, when you actually see what you need to do, it is very, very difficult. So let us just go to some of the components which Dr. Murthy mentioned with specific examples and see why it is not so easy or why it is difficult. Let's say that a postgraduate wants to undertake the diabetic foot ulcer and the new form of dressing that has been proposed by the plastic surgery department, and they want to see the healing time in a post surgical setting. They want to use the newer innovative method versus the conventional gauze and whatever the treatment they are giving. So if you take the study setting as the surgical OPD versus the minor OT versus a peripheral rural center, will there be any difference? I would request some of the students to just answer so that we can engage. Bhavya Tejashri, are you there, ma'am? Even the teachers have got used to taking online classes, so we will know how to engage. Thanks to COVID. Bhavya,
Yeah,
are you there? Or Ramesh Babu? Sir, I don't know whether you're faculty or this thing, so I'm just calling out a few names. Nash Shaika or Nikita Reddy, Nitya Ravichandra, Ramakrishna HK, Sri Raksha. Any one of you, can you just unmute?
Many are faculty only, Dr. Nandakumar.
Okay. So the faculty
Dr.
response.
Gargi, Dr. Gargi.
Yeah, probably sir, student or someone, they need to answer. No, I mean, if they want to. So the question is, like, if you do a diabetic foot ulcer dressing evaluation in OPD versus minor OT versus a primary health center in a rural area, the same materials versus gauze in 3 different settings, will the outcome be different or does it have any kind of a thing for the study setting?
So it will be different because
Will be
availability
different.
will be different.
What will be different, ma'am?
The availability
Of
of
what?
whatever we want
No,
and the
assuming that
type of
all
patients come. Okay.
exactly,
The
exactly.
type of patients coming.
Yeah. So if we say that, like, if we make available the entire materials, but the type of patients is different in a peripheral center versus an OT versus a minor OT of a tertiary care center. So the reason this setting makes a difference is as simple as Monday morning OPD cases versus Saturday night casualty cases are different. Most of the senior experienced surgeons would know that what comes on a Sunday evening or a Friday night is different from that of a Wednesday afternoon. The reason being there is a pattern to everything. And if we don't put in that pattern, in fact, it was a very interesting thing which we saw in one of the institutions where the same study was given to students after 3 years or 4 years, and the results were different. The surgeon was sort of like wondering, why is it? We have not changed the procedure, we have not changed the intervention, but why is the outcome different? It was a trauma-based assessment of a grading protocol, and they wanted to check its effectiveness in 2 or 3 different settings. So when they did that, they realized that the first unit, which was Monday, Wednesday, Friday, and the next time when they repeated the study, it was Tuesday, Thursday, and that kind of another thing. So what happened was the type of patients who were coming with the trauma, road traffic accidents over the weekend, the drunken driving and other things were different from the elective type of patients who were coming in, and there was a difference. So the reason I'm trying to put this is when students, especially the postgraduate students or the faculty, when we give topics to students, please be sort of like having this in mind, called as the Bergsonian bias, which is the selective rate of cases that come and admit over a period of time, which might change. Unless that variance is taken into consideration, your outcome and the research outcomes will change, not because of the setting or not because of the intervention, but because of the types of cases who are coming in. A very simple example, again, to make things more clearer, is the total number of deaths in Jaideva because of acute MI is highest as compared to, let's say, any other teaching institution. So when you look at apple to apple and oranges to oranges and not compare apple with oranges, you will see that the type of cases with more severity, with poorer prognosis, with massive MI go to Jaideva on a whole. And the proportional mortality of such graded cases will be relatively higher, relatively. But when you actually compare the prognostic factors with baseline comparison, you will see that the outcomes will be far more better in such centers because of highly specialized interventions. So this is something which we need to keep in mind. Next, we'll go to the study population. Will it make a difference? And when we choose a study, usually we say that all adults. The study was done in adults aged 15 to 45 or 15 to 60. What is your exclusion criteria? All children and all geriatric age group were excluded. So does including this 15 to 60, will it have any bearing is the question. Somebody wants to respond? Okay, otherwise I'll go it as a monologue.
Yeah, I think we will only end up interacting, Nandakumar.
Vishwanath sir, I'm seeing your
Nice
name.
if others are asking questions. It'll be
Yeah.
more interactive.
So will it have a difference if you take 15 to 60 years as a single group for assessing the outcomes of a lap cholecystectomy?
Yeah.
Or if we have two groups, 15 to 30, 31 to 60.
Definitely, if you look at cholelithiasis, will that have an effect
Absolutely.
on
So when you look
the
at the
sample
gender,
size?
we are not talking about the
Is
sample
that
size yet.
what?
Yeah, we are talking about the study population and the inclusion and
Yeah.
exclusion criteria. Because the causes of cases, if they are different, the outcomes will be different. Because unless we have a similar homogeneous population to start with, the whole purpose of inclusion and exclusion criteria is to ensure internal validity so that when you try to extrapolate to similar cases outside the realm, it will become far more stronger. So many of us write, I mean, like inclusion criteria, absolutely there is no challenge. When we are writing an inclusion criteria, let's say that we are doing the study to assess the incidence of appendicitis among adolescent girls in urban area. So what would be the exclusion criteria? The study is to look at incidence of appendicitis among urban adolescent girls. what would be the exclusion criteria? Sampath Kumar or Sukumar or
Dr. Sampath Kumar is our past president of SSB.
so the senior most
Oh, yes, 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 that's right.
because that's the challenge which we face on online. Or Aisha Mufida or
Yeah, she must be. Anybody else? Even I'm not able to see any of our PG's names other to ask.
Nikita. We have one Nikita Reddy or Naz Shahika.
Dr. Naz also is our
Yeah,
EC, past EC.
Ravi Somayagowda. Anyway, I mean, like I think
Yeah,
it's.
I think we just go about, yeah, discussing. We will only interact.
I mean, I can just go on with the examples. So when
Yes.
you look at this inclusion and exclusion criteria, exclusion is a subset. So most of the times we say that when this thing of appendicitis among adolescent girls, when we take 90% of the protocols when we see for Rajiv Gandhi University or any other university, we see that they would have excluded all the boys, all the non-adolescent boys. So it is like saying that you're going to a restaurant and there is a set of menu and you have some 10 items. It's an Italian restaurant and you say that I don't want to eat idli. Idli is not there on the menu for you to exclude. So the whole point is your exclusion criteria should be a subset of whom you have included. So that's extremely important while you're writing the inclusion and exclusion criteria, so that within the included people, if there are some variations, if there is an anatomical variation, or if there is the underlying pathophysiology which is different, then probably the outcome will be related to that. And that is the reason we are excluding that subset from the larger included people. Then quickly we'll move on to sample size, which basically says that the people or the cases who have been included for the surgical intervention are similar to other people who are likely to be included for this surgical intervention. So, in that context, whenever you're looking at any of these individuals, the sample size estimation, both as a quantity and the way you collect these people, which is the sampling technique, becomes very, very important. If the sample size, most of the postgraduates come and ask, sir, you are saying that we need to do 80 cases, but in our in our hospital we get around 30 or 40. Can you reduce the sample size? The statistician feels, yes, why not? We will increase the error, because when you're calculating the sample size, you have two broad types of errors that can creep in. One is the alpha error, the other one is the beta error. So the alpha error tries to say that, like, whenever there is a difference, you identify that difference as being there. And whenever there is no difference, you don't erroneously bring in the difference because of your process. So the alpha and beta are very important whenever you are trying to intervene and see whether there is a difference between the outcomes among the people whom you have done the surgical procedure using a particular technique, and among those you have used a control procedure. So estimating the sample size should happen even before you start thinking about the study, for the reason that if there are not sufficient such number of cases after you initiate the study, doing the sample size estimation will not have any bearing. So please speak to the statistician. And in fact, now there is a new trend in our institution where they are saying, sir, we have three topics. You calculate sample size for all the three. Depending on what my professor will say, I'm going to use it. Fair enough. But the point is, like, if you're not getting such number of cases, then there is no point in going ahead with this study. So the sample size estimation and the sampling technique, whether you use baseline adaptive sampling, or especially for surgical procedures, we say block randomization. So what we mean that even within a small 5 or 10 people, we are internally randomizing, so that if you don't reach your actual sample size also, you'll be having some value coming out of those smaller 10, 15 or 20 samples that you would have considered for this study. And it's a quite a what you call as complex approach, but with today's computers and means and methods, you can easily get the block randomization thing, and you can allocate the patients into either the intervention group or the control group. The most important thing from a surgical protocol point of view is the procedural description. Because many a times we see surgeons who would have written extremely well-defined surgical notes, more so to protect themselves or the institution from litigation and other claims that we are seeing. When it comes to research methodology, you'll say the procedure will be done. The whole point is like, is there something which an uninitiated external reviewer will be able to identify the whole steps? That is very important. And unless the procedural details are extremely well written, the chances of such studies getting published in good journals will be very, very difficult. So these three things, when you look at the sample size, when you look at the sampling technique and the procedure, they form the crux for the thesis getting published in a fairly good journal or not being published at all. Recently, when we looked at the statistics of not only our institution, but around 6 or 7 institutions, only 14% of the postgraduate theses are being published in any of the indexed journals. Of course, 30 or 40% will get published. But when you look at where the other 27% are being published, they are in predatory journals where 5,000 or 7,000 you pay, or up to 20 or 30,000 I'm given to understand. And you will be getting it published without peer review, without any kind of standardization and scrutiny. And that will be subserving your requirement for DOAJ or minimal. Sometimes Scopus also has these predatory journals. So if you have your sample size and the procedure very clearly written, BMJ today publishes case series, case reports, and student BMJ is a very good what you call as opportunity for students to ensure that the research is published and peer reviewed. So please ensure the sample size, the sampling technique, and the procedure is very well described. Then the data collection. This is a challenge which we see in surgical sciences, because most or many a times there won't
Dr.
be
Nandakumar, just 1 second.
Yeah.
To this methods and materials, what exactly they have to write, if you can just describe.
What
Like, for example, laparoscopic cholecystectomy, what are the complications? This is our title, outcome of cholecystectomy. What materials and methods they should write? Or the diabetic
entire
foot,
thing
whatever
is exactly the entire thing what I put on this slide is material and methods. Precisely, I'm focusing exclusively on that. So let's take the specific example of laparoscopic cholecystectomy as a procedure, and you're looking at the complication. In fact, if Hebsur sir gives an award for the maximum number of studies done, this will be the topic of choice, because you would see the complications, follow-up, difference between lap poly versus conventional surgery in our setting, in their setting, in rural versus urban, in the tertiary care hospital in South India. This is the most common thing. Despite that, it will not get published for the reason they would not have given what would be the type of patients, the baseline characteristics of the patients who will be included for the study. They would not have told who would be excluded among your included population, because that makes a very huge bearing. If at all, if it is, you have multiple stages, multiple complications, multiple comorbidities, multiple ways in which the patient can present, or with a added infection. So all these will become extremely important whenever you're writing the methodology, unless these factors are borne in mind while writing the study protocol. After collecting the details, usually such studies, how they are done is, either it would be a retrospective study or an ambispective. We will take 50 such cases which have been done in the past from the records, and 20 cases in future. Totally, we will make 70. So in such instances, whenever you're looking at the methodology, unless you're very clear that the 50 from the past are very similar in procedure, whatever you're describing, that should be standardized, which means that each of the procedure is done by a trained surgeon who has done at least X number of surgeries. Because if at all, if there is a difference in the skill level of the person who is intervening, the outcome will certainly have a different bearing. So in that context, most of the time we tend to not write those qualifiers into the procedural things. It is done under supervision. It is done under using these steps. Is there an OSCE or an OSPI which will be seen for ensuring the critical steps of the procedure is done or not? Especially for medical education, now we have competency-based medical education. And surgical skills are very essential to be actually transmitted or transferred on. So in that context, especially from a thesis point of view, it would be a very good point. I mean, at this juncture, I would like to request you can actually from the surgical society give a set of 10 topics which are of very high importance and give a guideline saying that these are the steps. Yeah, your sample size will increase because 10 centers will be doing a similar type of this thing study, and that can be published as a multi-centric study with let's say 300 cases or 400 cases as against just a 30 case from a single center. So the procedure, to answer your question, madam, it should be very clearly written as to how it will be done, under what conditions it would be done, and in case of a complication, what would be the complication and how it would be measured and documented. So the entire spectrum, it is as good as writing a surgical notes. Those components should be there in the protocol so that for the uninitiated or someone reading it, it should give a complete blueprint of how the whole thing has been collected. So that's what I was telling you. With the data collection or the questionnaire, today 90% of the students use the case sheets as the tool for extracting data. They just enter it into an Excel. And that is a known practice, accepted. They analyze, they will get 5 tables, 6 graphs if they pay 5,000 rupees elsewhere. And we can't even say that that's wrong or anything. But unless there is a questionnaire for the variables of interest, you will be missed out because the case sheet is not a research tool. Case sheet is a document for patient monitoring and patient progress and a medico-legal document. But when you are looking at research, the critical thing that you would require, whether that component is there. So that is very important. So your variables of interest for the research needs to be mentioned. And that is the pre-validation of the questionnaire, which needs to be done with a 4 or 5 professors sitting together to say that, look, this tool has all the required information to know that the outcome can be attributed to the intervention. It is not a spurious outcome that we are seeing. So that is what is meant by the validation of the questionnaire. And of course, the data analysis, consulting a statistician prior to the study is very important. So we'll be having the descriptive statistics, which talks about the patient disposition, which says that whether your cases and controls, intervention and the control group are similar, and there is no statistical significant difference at this level. And once you go to inferential statistics to see that the outcomes, the healing time, the time to recovery is better, then it can be attributed only to the intervention and not to any of those factors. And also the expected outcome, many a times this is where we err, because we wouldn't have written the primary endpoint and secondary endpoint. We say that complications, is it in the first 48 hours or the first week, second week? Because most of us know the primary complications are different from secondary and tertiary complications. So whenever we are writing a protocol, this part of the methodology, material and methods, is extremely important as any other thing. Review of literature, those are all interest making things, but your crux of the research will be dependent on these things. And as Dr. Murthy told, what we have shown is only the trailer of the whole picture. So it's not even a 2020, it's a 5-over match. So unless the students are aware and the importance of it is known, because like for most of us, it is like a necessary step to finish our PG thesis. And thankfully, they've also introduced for DM and MCH, thesis is mandated now. So in that context, understanding the research methodology, even for interpreting the journal articles, it becomes very important. So probably I will stop here in the interest of time. If there are a couple of questions, we can take it and answer.
Yeah, there is one question, Dr. Kumar,
Yeah.
is there a minimum sample and minimal study period for any research?
Yeah. Sangamesh has asked that. See, the sample depends on your primary objective. So, if at all, if the objective is to compare, to assess the effectiveness, so based on a particular number, if the effectiveness is assessed as a quantity, then to achieve that delta, we might have to take 40, 50, 60 cases with a relative error. Sample size calculation takes into consideration the event of interest, its occurrence, alpha and beta error, the group variance, and the error fraction. So all these put together, the minimum will be dependent. So, and that minimum is not 30, 20 for all the types of studies. So that changes from study to study and for the same study in a different setting. So that is the thing. And the study period also depends on what is your objective. So it can be, if it is an acute complication, it is just 8 hours or 20 hours or 24 hours. You can define it. But if it is a chronic outcome, 6-month recovery or time to heal. So that healing, as you define, it will define the research study.
So if a
Sir,
minimum
another
size
thing.
is given, sorry,
Sorry, madam. Sir,
please go
another
ahead.
thing, if we are dealing with some rare condition, then the sample size may be low also, as low as 10 also, isn't it?
One is a sample size, sir. One is a sample size. Yeah,
Okay.
because when you look at it, the rarest of rare conditions, that is where we say that research need not be a quantitative thing for the masses, because each case is unique. Because today, when you're going into personalized medicine, especially the omics, which Murthy was mentioning, so the metabolomics, genomics, and proteomics, when you put together for a single case, the outcome cannot be generalized. So very shortly, we will be seeing that the robotics or whatever we are talking about, the precision surgery will be linked to precision medicine with a drug-eluting nanobot being injected into a very narrow area for that bleed. So this is going to happen, and we will be getting single case reports which will be fed into computers to optimize that robot to do that precision surgery. So it will happen, sir. So 1, 10, or 15 will depend on the various things.
Thanks.
Okay, with the minimum sample size, again they have doubt whether we cannot go beyond that number. See, if the study finishes, say for example, sample size was 30 and the
Hmm.
study period was 18 months. And if they
Hmm.
finish in 3 months getting that
Hmm.
number, is it that
Hmm.
they should not continue, or um, is it that we can have a bigger number?
Okay. There are two questions here, madam. One is the sample size, meeting the sample number. So that to achieve that number, we would have given a duration of 1 year. If the
Yes.
number is met within 3 months, you can terminate the study because you have met the sample size.
Sample size.
On the contrary, if the follow-up period is for 8 months and the last case recruited is in October, which means that October plus 8 months will be the study duration. And just because you have met the last case, you won't be able to cessate the study. So the study duration refers to meeting the primary endpoint for the number of minimal cases as required by the sample. So both the things have to be taken into consideration, dose and duration kind of a thing.
But there is nothing wrong in extending the number of patients, right?
Absolutely. The more the merrier.
The merrier, exactly.
But
Again,
the
these were
challenge
all
is
the doubts of our PGs during
no.
synopsis
But no. I
review.
will also give a corollary for that. The more the merrier sounds good in English. But when you look at a surgical study, you also need to understand that upon analysis, if you find that the surgical outcome of the new procedure is having a slightly higher complication rate, then from an ethical point of view, you need to stop the study. Not only wait till the sample size is met.
Okay.
It's very challenging because questions to research can't be answered in yes or no. There are multiple gray zones in between, and the first and foremost is the ethics part of it. In fact, I didn't even elaborate on it because surgical ethics is a very tough thing, because as a surgeon you're deciding on the spot for certain things because it's a dynamic environment. What that is why we sometimes take consent when we look at these medical legal cases. They say that you've taken consent for A, but you did B. When you are in that position, it is like it's like an explosion. You won't be thinking logically. Your idea is to protect, save, conserve. So in that context, whenever you are taking these study designs or study in high risk populations, then the smallest number is also what it is sufficient. We don't go for statistical significance in such instances, like operating on children, operating on special groups. So in such instances, if the risk and the that is what Dr. Murthy was saying, the outcome is not it's not a interest of research. It is for the benefit of the people who are participating. That's a larger good that we need to keep in mind.
That was really excellent, sir. We really enjoyed the program so much, and I think so everybody understood how we can go about with this research and thesis and methodology. It was really interesting, sir. Thanks a lot, Dr. Chidambara Murthy, sir, and Dr. Nandakumar, sir. I request Kalaivani madam to please give the conclusion remarks. Madam, I think so.
Some network issues. Maybe she's gone.
Madam is back.
It was charged, battery was going on. I just connected.
Okay.
That's all. No,
Madam, please give a concluding remarks.
Yeah, I think from what we heard from both of them, if I think most of my PGs have joined the YouTube link, I just came to know, so they're not able to send the questions. But from all the PG thesis review, what I have been having for the last few days, the major mistake they write is in the title. That is, they start with, this is a study of, which is Dr. Nandakumar very clearly mentioned. Don't start, Dr. Murthy has mentioned, don't start any title as the study of, right? But the title also should include the type of study and what outcome we are looking at. But do not start as the study. This is the conclusion what I'm drawing from both of you. Is that right?
Yeah,
Dr.
absolutely.
Nandakumar? Fine. Yeah. The next thing they make mistake is in the objective. So the objectives they should have, they preferably use some verbs like to determine or to estimate. But instead, the objective they write usually to study the outcome of cholecystectomy. It does not make sense at all. To study, we are not studying it. We have to look at what is the outcome or what is the proportion of patients coming out with complications from laparoscopic cholecystectomy. So it is measurable. These are the mistakes what PGs do or we do in writing the paper. So I'm just bringing this out. Please correct me if I'm wrong. Dr. Nandakumar?
That's fine, that's absolutely fine. Perfect.
So the objective should be measurable and they should use preferably these words like determine or estimate and to compare.
Yeah. So the Bloom's taxonomy, as you are mentioning, is the Bloom's taxonomy where we use words which are action verbs.
Yes,
so
action words.
Action verbs, not exploratory.
Yes, yes, fine. And in materials and methods, they have to write the procedure also, what they are doing and all the data they have to collect. Another mistake they make is in discussion. The discussion, they again discuss about the results. In discussion, I think they have to compare their results with other authors' results and then explain about it. And again, conclusion is whatever objective they took, the conclusion should be exactly matching the objective. They cannot extrapolate their conclusion.
Perfect.
Right?
Yes. So the discussion, to put it in one line, if you have to say, is why you have got a result which is similar to others, why it is not similar to others.
Similar to others.
So
that is discussion.
Explanation of difference or similarity is what discussion is about in the light of extent knowledge, what is currently available.
Fine, fine. So thank you so much, Dr. Nandakumar and Dr. Murthy. Are there any other questions from anyone else?
No, in discussion, sir, if our study is different from the other standards, what is published study, is it necessary to mention that in what way it is different or how it is different?
Absolutely, sir. See, the very fact that it is different will be having certain causes for the delta. So either the baseline or the what you call as the gradings or some kind of a thing which would have cropped in to explain the difference. What we are, in fact, that is a very good way of saying it. You have to explain the difference, both the patient disposition or the methodological dispositions. So you need to say that, and you have to say why it is different. And many journals would love to have that thing, because in the Indian context, when I mean, like especially the arterial thickness. So when we look at the coronary grafting and other things, so there is a huge variation in the way the stents behave. Both the thermodynamic, I mean the fluid dynamics that happen in the vessels. So the Indian arteries are different. So similarly, be it be the muscles or be it be the way the recurrent hernias that happen.
Earphones charge ಮಾಡಿದ್ಯಾ no?
So that thing will be having variation. So probably you need to explain that.
Any other question?
Ma'am, there is little bit. Can you hear me?
Yes, sir.
Yes, sir.
Dr.
there is
Ramakrishna,
little
sir. So please.
And question. Sir was telling question, and after that leading to hypothesis. Is it the hypothesis which leads to research question, or research question leading to hypothesis? I think hypothesis is first, and that will lead to question, research question. What's your opinion?
Yes, sir. Murthy, do you want to take it up?
No, yeah, correct, sir. What you said is we need to have an hypothesis to say that what I mean. Most of us work with open-ended hypothesis, which is directly linked to the research question. Yeah. So I mean, it also depends on the, in medical field, most of the time what you said is right. Like we get an hypothesis, then form a research question.
Because in most of the slides, question came first and then hypothesis came. You are putting it in the other way. That's why I asked. And another thing I wanted to tell you is, you are telling you cannot extrapolate the outcome. That means a little bit confusing statement. I didn't understand what was that mean.
Sir, you have to unmute.
Dr. Murthy, you have to unmute. Dr. Chidambara Murthy, you have to unmute.
Yeah. So what I meant to say is, when we are discussing the outcome of the study, probably we need to keep the sample size and the experimental setup in mind. So most of the time, what happens, what works in 10 cases may not work in 100 cases. So if you take surgery in medicine, it's very easy. The effect, we always blame the gene at the end in case of effect of thing. Here also, it's the individually we say it worked on this, it may depend. So we always give a caution that this has worked in so many cases. Probably before we go to generalize the statement, we need to indicate that larger number would definitely give a better picture. So we have seen many hypotheses deviating when they when they work in the larger scale. That's the thing I wanted to say.
No, sir. If you cannot extrapolate the result of your study to larger population, then what is the use of doing this study?
No.
Our idea.
No, extrapolation means you can use that information to plan the study. So what extrapolation? What I meant is, like when you're designing a study, if you have found 6% or 60% thing, when you're considering the next higher population, then you can extrapolate the information, but not the result. See, what I mean, you are probably taking the outcome of the study.
Can I just come in, sir? Just to from a doctor's perspective. So one is external validity and extrapolation, sir. So I think Ramakrishna, sir, I mean, both the points you have made is very valid. Hypothesis should come prior, because otherwise it leads to a phenomena called HARC. Hypothesis after results are known. Many a times that happens. We will have the results and we try to frame an hypothesis around those results. No. So hypothesis comes first and then the research question. And when it comes to extrapolation and external validity are two things. Because when we have the results, we say that like a study in South India, it would have been done in a tertiary care institution in Bangalore. So whether the South India represents the tertiary care institutions is what Dr. Murthy is saying. But if at all, if the conditions are similar in all tertiary care institutions, absolutely the external validity in that setting is there. Have I answered your question, sir, Ramakrishna, sir?
Yes, sir, to some extent. What I was insisting is you're talking about the results. I was talking about the conclusion.
Exactly.
So
External
after a
validity
study,
is there.
yes, sir, because that will reinforce whatever conclusion my study has given. If somebody else also do the same study and give the same conclusion,
Yes.
that will validate it externally. That means it is reinforcing my conclusion. But
Absolutely.
the conclusion should be extrapolated. It means it should be able to extrapolate that to similar similar population. That is one thing. What
You're
we
not
cannot
audible, sir.
extrapolate, not madam. What cannot be extrapolated is you cannot extrapolate
not
it beyond.
audible,
Madam,
sir. Your voice is breaking.
breaking. Is it? 1 second, I will take it to while.
Yeah, we can
Hello.
hear you now, sir. Please.
No, I was using
We can
headphone.
hear you now, sir.
Yeah, we cannot extrapolate the conclusion beyond the inclusion exclusion criteria. That means if we have defined study population as more than 40 years age, that conclusion cannot be extrapolated to the population less than 40 years age.
Absolutely
Yes.
right.
That's what we cannot extrapolate. But
Yes.
the conclusion should be extrapolated. Otherwise, the other person will not be able to use this study
Perfect,
result.
sir. Agreed, sir. Absolutely agreed. So for similar settings and similar population, provided our study population represents such similar population, both with the sample size adequacy and the sampling techniques, we can extrapolate and which will have an external validity. Fine, sir.
Yes, sir. Another thing, just I wanted to mention, the sample size is required to find the power of the study. This alpha, beta, probably our people may not be able to understand probably. So I use
We left
more
it, sir.
the false positive and false negative conclusions. Probably it is same meaning, but we people are more used to such words, so they will understand better if you use those sentences. False positive conclusion, false negative conclusion.
No,
The number of
certainly, sir. We will have a small session on sample size alone.
yes, sir.
Statistics for for doctors, Santa, we conduct a small 3-hour session where we talk statistics in sentences rather than alpha and beta. So that would be helpful. We'll do that.
Yes.
Thank you, sir. Thank you, Dr. Ramakrishna, sir. So, no more questions. No, there are no questions in the chat box. Yeah, thank you so much, Dr. Nandakumar and Dr. Murthy. I think that you explained it so elaborately, and I hope this gets extrapolated on all the faculty who are sitting here and listening, and also onto the PGs if they are there on the YouTube. Thank you so much, Dr. Nandakumar and Dr. Murthy. Thank you so
Thanks
much.
a lot.
Dr. Chandru?
Behalf of KCSI,
Dr. Chandru, please go ahead.
extend heartfelt thanks to Dr. Nandakumar and Dr. Chidambara Murthy for taking out their time and explaining most of the postgraduates and the consultants about the theses and the publications. Thank you very much, sir. And I thank all the members of KCSI, and also I thank the moderator, Dr. Kalaivani Madam, for an excellent work. Thank you, everyone. Thank you very much. Good night.
Thank you, sir. Thank you.